More than meets the eye. Episcleritis presenting as an adverse event of immune checkpoint inhibitors. I'm Dr. Natalie Perez-Mendez, and my co-authors are Dr. Nadia Lokhtar and Dr. Carlos Minyet Cespedes. We're affiliated with the Florida Atlantic University Charles Z. Schmidt College of Medicine Internal Medicine Residency Program. Immune checkpoint inhibitors, or ICIs, represent a new frontier of cancer therapy, enhancing patients' native immune systems to better control and eradicate malignancy. In up to 60% of patients, ICIs are also associated with the development of inflammatory lesions across a variety of organ systems. Episcleritis is a disease entity in which an abrupt onset of inflammation in the highly vascular episclera creates redness, irritation, and watering of the eyes without loss of vision. In rare cases, episcleritis can be an immune-mediated adverse effect of checkpoint inhibitor therapy and may occur in conjunction with additional systemic ICI-related toxicities. A 62-year-old man was admitted with a 2-day history of confusion, vomiting, and periumbilical pain. He had a history of metastatic melanoma, for which he recently started ipilimumab-nivolumab combination ICI therapy. He tolerated 2 rounds of treatment before presenting to our hospital 4 days after his last ICI infusion. Physical exam revealed fever, altered mental status, large primary melanoma lesion on his back, and painless bilateral conjunctivitis. He denied vision changes. CT of the abdomen indicated severe duodenal inflammation. On day 2 of admission, he began to have significant periorbital edema, hyperemia of bilateral sclera, and non-bloody, watery diarrhea. After a thorough infectious workup was unremarkable, the patient was started on high-dose intravenous corticosteroids and lubricant eye drops. Ophthalmology was consulted and ruled out other intrinsic ophthalmologic conditions such as uveitis. Figure 1 depicts our patient at day 1 of the IV methylprednisolone treatment. Figure 2 depicts our patient at day 3, and Figure 3 shows our patient at day 6 of this steroid treatment, revealing significant improvement in the episcleritis. Figure 4 is CT imaging of the abdomen. The yellow arrow indicates duodenitis, and the red arrow indicates the primary melanoma lesion. In conclusion, diagnosis of any inflammatory process in the setting of ICI should begin with expedited exclusion of infectious processes. Consider prompt ophthalmology consultation in appropriate cases. ICI-induced episcleritis is a rare but important adverse effect to remember when evaluating a patient presenting with red eyes undergoing immunotherapy treatment. Immunosuppression with high-dose IV corticosteroids led to a marked improvement of all symptoms within a few days. Our patient was discharged with a prednisone taper to be managed by his outpatient oncologist. Basic understanding of ICI mechanism of action and their adverse side effects is imperative for hospitalists and primary care physicians, since immunotherapy is an increasingly more utilized modality of treatment for many oncological patients. Here are our references. This concludes our presentation. Thank you very much for your time and consideration.